All right, thank you for joining us on today's episode of your favorite program, Earth Corner on Esteem Radio Vision, located at Obokun Avenue, Ilesha, Osun State, Nigeria. On your favorite program, Earth Talk, Earth Corner, what we do, we talk about things that concerns our health. And there is a general saying that health is wealth. If you are not healthy and you have money, that money may be nothing or meaningless in life. That is why you need to prioritize your health. The first thing that you need to think of whenever you wake is your health. Your health should be your concern. On this note, I'm welcoming you to your favorite program, Earth Corner. My appreciation goes to the Chief Executive Officer in person of Deacon Michael Adeboye Ashaolu, and to the all esteemed staff, I'm saying thank you for your support, thank you for your contribution towards this program. And I will not go without appreciate the man behind the button, Balogun Absamad, Big Balo. Thank you so much for your patience. I really appreciate you. And you know what we do, we normally have guests on the program who will give justice or analyze or educate us on what concerns us, what matters to our health. And there is no any other person than our nurse, that is nurse Nwoko. She is online right now. When it is time, you will hear our voice. My name is Adenipekun Afolabi, your host for today. All right, let's go straight to the topic that we bring for you today. You know, this particular topic is what many people there is a misconception of this topic that we want to talk about today, because some people, when they see someone lean, they will be saying, oh, maybe because of maybe the person is HIV carrier, unknown to them that there is another disease or sickness that can cause someone to be lean. Today, what is the topic? Diabetes. That is the topic that we want to treat for today. And to the layman meaning or definition, diabetes is a health condition where the body has trouble controlling the amount of sugar in the blood. That is the layman meaning or definition. But it is my I have a privilege to have Nurse Nwoko online with me right now. Good evening, Nurse Nwoko.
Good evening, Mr. Afolabi. Good evening, my viewers.
All right, thank you. The topic that we want to look at today, that is diabetes. You know, as a layman I am, and some people who are watching us right now, what we think or our own definition of diabetes is what I want to read out now. That is a health condition where the body has trouble controlling the amount of sugar in the blood. You as a professional, how can you define diabetes?
Thank you so much, Mr. Afolabi. Well, you have actually said it in a layman's language, but as a professional, I can give more details and polishing to it. So I can say that diabetes mellitus First of all, we have two types of diabetes. I just have to let us know. We have diabetes mellitus and diabetes insipidus. So we're talking about diabetes mellitus. So diabetes mellitus can be defined as a group of chronic metabolic disorders characterized by elevated blood glucose, which we call medically as hyperglycemia, resulting from problem with insulin production, insulin action, or both. So what do we mean by this insulin? This insulin is a hormone that is produced by the pancreas, and it helps to use glucose for energy. Without this insulin, without the insulin being used, without the production of insulin, the cells cannot convert glucose to energy. So when this insulin is insufficient or does not work properly, glucose builds up in the bloodstream. So in a nutshell, it's all about all that happens when there is a disorder in the level of blood level of sugar in the body due to inactivity of insulin or inability to produce insulin, or even both. That is what I can describe or add up to the layman's language you have given us about the definition of what diabetes mellitus is.
Okay.
Thank you.
All right. Thank you. You made mention of insulin. Uh, you know, somebody like me, I want you to expatiate more on that word of insulin. What does that mean? And how can someone know what you mean with the insulin?
All right. There is in the human body, there's what we call pancreas. Pancreas is is an organ that produces insulin. There's a place in the pancreas known as the islet of Langerhans that produces insulin by the beta cells. So this insulin is actually a hormone. It is a hormone in the body produced by the pancreas. This hormone helps to regulate the body sugar. If the body sugar is too much, this insulin will convert some of them into energy so that the body sugar will not be too much. And if it is too small, this insulin the production of insulin will be reduced so that there will be enough sugar that will circulate inside the bloodstream. So this insulin, as I can tell you, is a hormone produced by the pancreas that helps in the regulation of sugar in the body. Thank you.
Okay. Thank you, Nurse Nwoko. Yesterday, when we are discussing about the topic yesterday, which is the hypertension, you talked about the various types of hypertension. My question now is, this diabetes that we are talking about, do we have types or classes of diabetes?
Yes, we have types of diabetes. There are different types of diabetes. In fact, we have what we call type 1 diabetes, type 2 diabetes, gestational diabetes, and other specific types of diabetes. I will take them one after the other.
Okay, I want you to
type 1 diabetes.
Type 1 first.
Okay. Type 1 diabetes can be described as an autoimmune condition whereby the body immune system destroys insulin-producing beta cells in the pancreas. So when you have a type 1 diabetes, what happens is that your body system is destroying the body immune system is destroying the insulin-producing cells. That is what we call the beta cells in the pancreas that produces insulin. The body immune system is attacking it so that it cannot produce enough insulin, thereby leading to more sugar in the bloodstream, which is a form of type 1 diabetes. Another thing that can cause type 1 diabetes is as a result of little or no insulin production. Anything that can lead to little or no insulin production will give you a type 1 type of diabetes. Another thing you have to know about type 1 diabetes is that it usually begins in childhood or adolescence, but it can also occur at any age, but it's usually more in childhood or adolescence. Then for any form of type 1 diabetes, the person requires lifelong insulin therapy, that is artificial insulin. That's why you see some people that are diabetic, they tell you that they take injection. That injection is insulin. So for someone that has type 1 diabetes, the person has to be on lifelong insulin for the rest of his or her life. Thank you.
Okay, let's take the type 2 now.
All right. Type 2, this one is a common form of diabetes, is the most common form of diabetes all wide world. Okay, it is as a result of insulin resistance of cells to insulin. That is, cells do not respond properly to insulin. That is, the cells of the body will not respond to insulin as a result of resistance. This insulin that is being produced, the cells are resistant to it, they don't respond to it. That is the cause of this type 2 diabetes. Then another thing is that it is combined with progressive decline in insulin production. Then also it is associated with older age. It is seen mostly in people that are older. Genetics can also affect it. That is, it can run in families. Then people that are obese, people that are on the big side, they are, because of the fat cells that are being produced, the fat cells becomes resistant to the insulin that is being produced, or the little insulin that is in the body. Then physical inactivity, people that are not active physically can develop this type of type 2 diabetes. Then other certain ethnic groups, it is common in some group of people. Also, it can also be managed through lifestyle changes. This type of diabetes, you can manage it through lifestyle changes, or with oral medication, or also with insulin if there is need. That is, if the cell resistance is too high, that the sugar level is in the body is too high, you can now resort to insulin. But medically, you can manage it with lifestyle changes and oral medication. Thank you.
Okay, before we move to the third type of the diabetes, you talked about the that a certain ethnic background. I mean, people who are paramount. I mean, they who can get this diabetes that we are discussed. I want to know what which of the ethnics are you talking about?
It can be black Africans, African, mostly you seen mostly in Africans, mostly in African, and the people that are also in black and also Americans. So most of the obese Americans, you can find it in them, in those people. So people that are most people that, especially the ethnic groups that have most of their staple food as carbohydrates, just like as we have it in most African communities,
Countries.
where normal foods are mostly sugar, carbohydrate, which is the end product is sugar. Because every form of carbohydrate you take, the end product is sugar. Do you understand? So such ethnic groups that has most of their foods as carbohydrates, most of their staple food as carbohydrates, end up coming down with diabetes.
Okay, you mean any food that has to do with the carbohydrates can add to the level of one's diabetes? Is that what you are saying, Ima?
Yes, consistent consumption of foods that are mostly rich in pure carbohydrates, because the end product of carbohydrate is sugar. So you can find out if you see somebody that is eating garri in the morning, garri in the afternoon, garri in the night, or maybe continuously throughout the week, or garri in the morning, rice in the afternoon, yam in the night, like we have it over here. Somebody that eats rice in the morning, I eat garri in the afternoon, I eat yam in the night, might think he's changing food. He doesn't know he's eating the same type of carbohydrate, and the end product of every carbohydrate is sugar. So you find out that such a person, because of their ethnicity of the type of food they produce in that ethnic group, it can cause that person to people in that group to come down with diabetes more. That is why you find diabetes mellitus more in African community, and also in obese America, because of the kind of junk food that they eat. So
Oh,
that's just
okay.
it.
What you are saying now is that we should do away with taking too much of carbohydrates now. Oh, you know,
Yes.
I learned from this because many Nigerians, we believe that eating rice in the morning, when it is night, you pant your yam or you eat it raw, or maybe you have semo and this. We believe that we are changing food. I don't know that we are still taking the same food like that. Okay, Thank you for your response on that. Now, before I ask the next question, I want us to look at the other types of the diabetes.
All right. The third type of diabetes is what is known as gestational diabetes. This one develops during pregnancy due to hormonal changes that causes insulin resistance. So usually it resolves after birth, but it increases the mother's and the child's risk of developing type 2 diabetes later in life. So this type of diabetes, you can find a woman that is not diabetic before getting pregnant. When she becomes pregnant, because of during pregnancy, there are a lot of hormonal changes, and these hormonal changes can cause the insulin in the body to be resistant. So, but it resolves after the person gives birth to the baby. But the study shows that such a mother or the child is at a greater risk of developing type 2 diabetes, the one we described before, the one we say that is common and that it is as a result of insulin resistance, and is also associated with older age and genetics and obesity and all the rest of them. Thank you.
Okay. It means for the fact that one is maybe as a mother or as a woman, you you are not diagnosed as a diabetic patient, but as a result of pregnancy, one can later be a patient of diabetes. Okay. With this now,
Yes.
is there any other types of diabetes before we proceed?
Yes, there are other types of diabetes, other specific types. The ones that can occur due to genetic defects, the ones that can occur due to pancreatic disorder, and the ones that occur due to endocrine disorder, medications, or infections. So what I mean by all this is that as a result of genetic defects, maybe during formation of formation of a baby, there could be a defect in the pancreas as or a gene, a kind of a gene that is defected. So later in life, it will manifest as diabetes. Also, the pancreas might have a disorder, or the beta cells that in the pancreas that produces the insulin might have a disorder, and that can lead to diabetes. Even the endocrine system can have a disorder that can lead to diabetes. Medications or infections can also lead to diabetes.
Thank you for that response. Now, my question now is, okay, for instance, especially the Yoruba ethnics, what we believe is when you see someone having injury is in his or her body, but that injury insisted to even to heal, and people will say, oh, this is as a result of metaphysics or what have you. Okay, with this diabetes, if someone have wound and he or she diagnosed as a diabetic patient, can this contribute to the I mean, for that wound not to be healed on time? I want to know.
100%, because the sugar in the blood will not allow the healing process for the wound to continue. The sugar in the blood interferes with what we call the wound healing process. So it makes the wound not to heal very well. It affects wound healing process. That is why diabetic patients, they have what we call diabetic foot ulcer. It is very difficult to treat. So it's a specialist in wound healing that can take care of such diabetic foot ulcers. And they have this kind of a pungent smell, very bad odor that you cannot even stay with them. So diabetes can actually make a wound not to heal very well.
Okay, now my question is this: if someone is a diabetic patient and he or she need to be operated, is it advisable for such person to get operated when the person is diabetic, having diabetics?
Well, it is within the doctor's discretion to decide. If the operation is life-threatening, that his life is at risk, yes, it can be done, but with the regulation of the blood sugar. If it is something they need to place the person on insulin so that it will reduce the blood sugar, they will place the person on insulin and they'll go ahead and do the surgery. So afterwards, the sugar level will be controlled so that the healing process can also be fastened. Then they could also place the person on vitamin C and other vegetable foods and other vitamins that can help wound healing fast. Thank you.
Okay. Now, what are the common symptoms of diabetics? What are the common?
Very commonly, you can see things like excessive thirst, which we call polydipsia in medical terms, frequent urination.
Are you there? Oh, are you there?
Blood vision, unexplained weight loss, and slow healing of wound, as we talked before, or frequent infections.
Okay. What other things that are the common symptoms of diabetics? Hello?
I've mentioned them. I said, hello?
Okay, there is a break in transmission.
Okay.
Yes.
I said we have excessive thirst, which we call polydipsia, frequent urination, which we call polyuria, increase in hunger, which we call polyphagia, fatigue, blood vision, unexplained weight loss, more common in type 1. We have slow healing of wounds and frequent infections.
Okay. Now, with this, what are the complications of diabetics?
We have prolonged hyperglycemia that can damage the blood vessels and nerves. And when there is prolonged hyperglycemia that damages blood vessels and nerves, it can lead to what we call cardiovascular diseases. It can lead to kidney damage, which we call diabetic nephropathy. It can lead to eye disease, which we call diabetic retinopathy. It can lead to nerve damage, which we call neuropathy. It can lead to foot ulcers and amputation. It can also increase the risk of infection.
Okay. Is this diabetes? Can someone diagnose it? Is it diagnosable?
Yes, very, very well. It can be diagnosed. You can diagnose this through a lot of blood tests. There's what we call fasting blood sugar or fasting plasma glucose. We have HbA1c, which checks the average blood sugar level over 3 months. We have oral glucose tolerance test. We have random blood sugar level check. All these things are the way you can diagnose diabetes mellitus.
Okay, all right. If someone is having diabetics, how can we manage this?
Well, you can manage it in different ways. First of all, you can talk about having a healthy diet and regular physical exercise, checking the blood glucose level, taking medications, oral medications, injectables or insulin. Then also weight management. We also have education and regular medical checkup and follow-up. But the most important thing is for you to check your blood glucose level. The level will determine whether diet and regular physical exercise will take care of that, which is changing lifestyle. Because if it is a type 2 diabetes, it can be managed with changing lifestyle and regular physical exercise. But if it is type 1 and diabetes and gestational diabetes, you may need to go ahead with take injectables and oral medications. So that is it.
Okay, thank you, Ma, for your time. Just before I will let you go on the program for today, is that do you? I want to hear your own advice for diabetic patients and for people who are yet to be diagnosed, and what can we do in order not to be victim or in order not to be a diabetic patient? And for those who are already diagnosed as a diabetic patient, what can they do? Your advice for every one of us generally.
Well, my general advice for every individual is to check your blood glucose level regularly. And for those already diagnosed with diabetes, especially those on insulin, they should also check their blood sugar every morning before they take the shot of insulin. Just like we talked about hypertension yesterday. For diabetes, before you take a shot of insulin, you make sure you check your blood sugar level. If it is low, you don't need to give yourself the insulin again, so that you don't go into hypoglycemia and start having, because it can also kill. is also a dangerous thing. So also for those that are not yet diagnosed of diabetes, they should eat healthy diets and also do regular physical education exercise, also reduce their sugar intake and maintain good hygiene, because good hygiene also helps very well. It prevents a lot of infections that can lead to diabetes.
Okay,
So
what type of exercise can you recommend for people who are yet to diagnose as a diabetic patient and who don't want to be? Do you have any type of exercise you can recommend?
okay, regular workouts, skipping, jogging, all those minor exercises, they are all good that you do regularly. But if the person is obese, the person can extend it a little bit so that he can go as far as shedding some weight with it. But if it's a normal person that just want to keep fit, simple workout, jogging, and skipping of rope is enough to take care of, to maintain the person's body's health.
Okay, all right. Thank you, Nurse Nwoko Ezinne Mary Constance. We really appreciate you for taking out of your tight schedule to be on here with us. We appreciate you. That means till Monday that we will be having you back on your favorite program, the Earth Corner. From all of us here, we are saying thank you for giving us your time, for giving us out of your tight schedule. You can still make it to be here. Really appreciate you. Thank you, Ma, for your time.
Thank you. It's my pleasure.
All right, till Monday, I'm saying bye to you.
Bye.
All right, Ma, thank you. All right, and to all our esteemed viewer, we say thank you for joining us today once again on your favorite program, Health Corner, where I believe we've learned a lot of things today from our health practitioner, Nurse Nwoko Ezinne Mary Constant. We appreciate the kind of advice she gave, that we should try as much as possible to have a regular exercise and to eat healthy diet. Not that you eat uh, amala in the morning or rice, afternoon you take gari, and when it is night you want to have your dinner. You say, oh, let me quickly get semo or pandaya. We are still eating the same food, which is the carbohydrate. We have to change our food, and if you want to eat rice, try to mix it with beans, and even if you have money you can add egg to it, just for us to have a mixture of nutrition, so that it will not be that we are taking carbohydrates in order to avoid diabetes. And for those who have diagnosed as a diabetic patient, you should try to take your medication and engage yourself with regular exercise. On this note, I'm saying until Monday that we'll meet again on your favorite program. Let me appreciate the chief executive producer, Deacon Michael Adeboye Ashaolo. We really appreciate your effort. Thank you so much, and many thanks to Eni Akwonle Foundation, who is the sponsor of this program. And the Eni Akwonle Foundation is being funded by Deacon Michael Adeboye Ashaolo. And I want to appreciate the mind behind the console, Balogun at Samad, Big Balo. Thank you for your time. I really appreciate you. And to all our esteemed viewers, I'm saying thank you. I still remain my humble self, Adenipekun Afolabi. Till Monday that we'll meet again, I'm saying to you, make sure you eat the taste. What I'm saying is that make sure you eat healthy food. Don't just eat that, oh, for eating sake, let me just eat what I have. It is good for someone to be contented with what you have, but what I'm saying is eat healthy food. Until Monday that we'll meet again, I'm saying to you, your health should be prioritized, should be the first thing. Make sure you work towards it. Your health first, Till next week, I'm saying bye for now.